Hello everybody. Today we will discuss briefly about transducer and piezoelectric crystals, and mainly about different terminologies used in ultrasound. So let's begin with the lecture. The ultrasound probe, also known as the transducer, is indeed the fundamental component of ultrasound imaging, though we will study in detail about its construction and its different types later in our discussion. Right now we should know that an ultrasound transducer is basic unit of ultrasound imaging. You can describe it as a small device that sends out sound waves into the body. It also works like a microphone, picking up or listening the echoes of these sound waves bouncing back from different structures inside body. These echoes are then converted into electrical signals. A computer takes these signals and turns them into images that doctors can see on a screen, which helps doctors of knowing what's happening inside without using any harmful radiation, as they don't involve any radiation, unlike X-rays or CT scans. As we have already studied, a piezoelectric crystal is made up of special material that exhibits the property of piezoelectricity. The key characteristic of a piezoelectric crystal is its ability to convert one form of energy into another, allowing it to convert mechanical energy into electrical energy and vice versa. This unique property makes piezoelectric crystals valuable in ultrasound imaging. Piezoelectric crystals are indeed positioned near the surface of ultrasound transducers, and this arrangement is crucial for their function in generating and detecting ultrasound waves. The arrangement of each crystal depends on the specific application and the desired functionality of the device. The direct piezoelectric effect is an effect that simply describes the fact that when mechanical energy or pressure applied to a piezoelectric material by the returning or reflected sound wave as an echo, the piezoelectric material squeezes and will generate voltage, or you can say electric current, which is processed by the machine and displayed as an ultrasound image on the screen. Reverse piezoelectric effect occurs when voltage is applied by machine on the crystal, which resonates at some characteristic frequency. It changes shape, that is deformed, and converts electrical energy into mechanical energy to produces a mechanical wave or sound wave which enters into body. We use different terminologies while describing an ultrasound image. In our ultrasound discussions and reporting, we use specific terms to describe what we see without referring to colors like black and white. These terminologies allow us to effectively communicate and report our findings during ultrasound examinations. It helps ensure clear and accurate communication between healthcare providers and improves the quality of patient care. Regarding terminologies used to describe an ultrasound image, which is made up of lighter and darker areas and several shades of gray. The feature of a structure being lighter or darker on the screen is called echogenicity. While writing a report or discussing an image, we use the relative echogenicity of certain areas to characterize them, whether structure is white or bright, or tissue is less bright, or it is appear black on the image, or whether two adjacent structures or tissues that are of the same echogenicity. So in conclusion, echogenicity refers to brightness of an object caused by reflection on the ultrasound image. It means no, and echoes means white spots. So the term anechoic refers to structures or areas in an ultrasound image that appear black or without internal echoes. Anechoic structures have no sound reflections or echoes occurring within them. All sound wave is transmitted. This lack of reflected echoes results in a black appearance on the ultrasound image. Anechoic structures are commonly associated with cystic masses. Cysts are fluid-filled structures that exhibit anechoic characteristics. Examples of anechoic structures include the gallbladder, the urinary bladder, and simple cysts. These structures typically contain fluid and appear black on the ultrasound image due to the absence of internal echoes. Hypo means less, and echoes once again means white spots. So the term hypoechoic refers to structures or areas in an ultrasound image that appear having less internal echoes. Hypoechoic structures produces a low amplitude echo image. Hypoechoic structures have only few reflections or echoes occurring within them, and the remaining sound wave is transmitted. This few inter-echoes results in structure to be seen as different shades of gray on the ultrasound image. Hypoechoic structures are commonly associated with solid masses and soft tissues. Examples of hypoechoic structures include the liver, the spleen, and pancreas. Hyper means increased, like hypertension, which means increased blood pressure, and echoes once again means white spots. The term hyperechoic describes structures or areas in an ultrasound image that appear brighter or white due to the presence of numerous or increased number of internal echoes. Now this is important to remember that due to their composition of structure, ultrasound waves, when encounter hyperechoic structures, nearly all of the sound wave is reflected back to the transducer, which results in a high number of echoes and a bright appearance on the ultrasound image. And as all sound is reflected back and nothing transmitted, so usually you see shadowing behind such structures. These echoes have high amplitude reflection, meaning they are strong and bright on the ultrasound image. For example, hyperechoic structures are commonly associated with dense tissues like diaphragm and solid masses, like stone and bone. In summary, hyperechoic structures in ultrasound imaging appear as bright or white areas on the image. They are characterized by having many internal echoes, which are caused by high amplitude reflections. ISO means same, and echo once again means white spot. The term isoechoic refers to structures or areas in an ultrasound image that have the same level of echogenicity as that of surrounding tissues. In other words, isoechoic structures appear similar in brightness or echogenicity to surrounding tissues on the ultrasound image. Isoechoic structures have echoes of similar intensity or amplitude compared to surrounding tissues. This means they reflect a similar amount of ultrasound waves to the transducer, resulting in a similar appearance on the ultrasound image, while isoechoic structures tends to blend in with surrounding tissues and may not be easily identifiable, but the subtle differences in echogenicity and their capsular surrounding margins can help identify abnormalities or pathology. Pathological conditions, such as early-stage tumors, may appear isoechoic to surrounding tissues. So in summary, the most commonly used terminologies are anechoic, which means all the sound waves are transmitted through that structure and nearly no reflection, such as occur while passing through fluid, resulting in no signal, while in case of hypoechoic, some sound wave are reflected and some transmitted, so the structures show internal echoes with different shades of gray, like in soft tissues. In case of hyperechoic, it is totally opposite to anechoic, in which nearly all the signals are reflected and nothing transmitted, such as occur in bones or air or gases. In the following image, for example, if you want To specify the renal pelvis, blue arrows, you would write that there is a hyperechoic area in the midfield surrounded by hypoechoic renal parenchyma. The liver parenchyma or functional tissue is also hypoechoic. In the second image of a fetus, the fetal skull is echogenic, the brain tissue is hypoechoic, and the amniotic fluid is anechoic. Hope you liked the lecture. With this we conclude our lecture. Our next lecture will be on pulsed ultrasound and how an ultrasound image is formed using pulse echo phenomenon.